when we talk about guided surgery, there's different nomenclatures involved, and it's what's the difference between just a guided osteotomy versus fully guided? Fully guided, really what that means is that you do the osteotomy through the guide and you deliver the implant through the guide, and so the guide never comes off, in theory. And so fully guided means that implant goes in and it stops when your driver hits the guide, and it has some sort of depth stop and potentially even a rotation timing component where you can control literally the timing of the hex in that implant. Maybe a guided osteotomy would be drill the hole, take it off, throw it away, and then take your implant and go in right without the guide, which is fine, right? Because then you can see the bone, you can see the implant. Sometimes there's a place for that. Pilot guided would mean your pilot drill goes through a small cylinder in a guide to get your orientation and your position, close, and then you go take it off and you do your traditional osteotomy through that. So there's different reasons for using different components at different times, but generally, with Blue Sky, with this whole workflow, most of the time it's a fully guided process, and it goes really well. Implant timing is that nature of not only controlling the depth, but controlling where the implant stops in its rotation. So you think about that recommendation of always leave the flat of your hex on the buckle. I know a lot of us were taught that when placing implants. Kind of makes for a restorative process that flows well. But when we start getting into pre-printed temps that were made before the surgery, timing really matters. Because if you made your crown here with your hex here and the implant lines up here and they're not matching up, and if you had to put that crown on and it's turned 20 degrees, that didn't follow the plan accordingly. So timing comes into that. And that gets into course number 2. So when we get into the next level of planning, we talk about how do we make these implants timed so that components line up. And then when we talk about multi-unit abutments, and we talk about angled multi-unit abutments in course 4 when we're doing full arch guides, the timing will displace that multi-unit abutment in that screw hole path for our hybrids. And so if you had a hybrid pre-printed with holes in it for that pickup, where the implants are timed for your angled multi-units, that matters.